Let's get the finish. That's just let me just fall out. Good morning, everybody. Good morning. Welcome to today's training. I hope you can hear us from wherever you're joining in. The Director General of Education Quality Assurance. Good morning, Ma. The representative of all the health team. Good morning. Please, if the health team is on the attendee page, please kindly use the raise hand button so that I can just move you up to the panel, to the panelists, please. Please, while we await the health team, let us have your introductions in the chat box. Let us know where you're joining us from. Okay, dear participants online, please, we'll be starting shortly. In the next 5 minutes, we want more people to join in.
Miss Fauzia, I'm sorry,
I've
been trying to reach you. Please, let's get started. This is supposed to start for 11 and it is 11:24. Please let's get started. I've also sent you the documentation to share the screen. Okay, thank you.
And I'll be sharing the screen in a bit, please.
Good morning, everyone. Thank you so much. As you all know, it's very unlike us to not start roughly on time. We do give our deepest apologies for starting quite late, but we are getting started as we await our other panelists from the Ministry of Health. I want to thank you for coming to this training today. So this training really is about the guidelines that we have set forth for the prevention and management of COVID-19 in schools. It has been quite a journey since COVID-19, I believe now Omicron is now in the States, but it's been a journey for the state, for schools, for students, in fact, for everyone. And I really want to salute you all for the wonderful work that you have been doing. Despite it all, you have been teaching, WIAC results have gone up, and you are really doing the best that you can with what you have. And we acknowledge you, we appreciate you. So thank you again for making time out on a Friday to be with us today. And we thought it was really important that we have a very small sensitization training on the guidelines. So as we all know, federal government had given guidelines for all schools in, I think, June 2020. June 2020, I believe. We're all on lockdown during that time, and these guidelines came out. As a state, we really had to look at the feasibility of those guidelines and how they could be practical for use. As a result of that, we created a 1-hour training course, and we mandated that every teacher, every school leader take that course, which was, of course, based on federal government guidelines, as well as international best practices, right? The things that you're supposed to do, things to keep in mind. We further told schools that they are to submit certain plans. Those plans centered on operations, how the schools are to be run. They centered on health, sanitation, and safety, the frequency in which cleaning was done, where cleaning was done, who was accounting for them. We also said that they should submit plans based on communication, right? How are you communicating with your parents, with your teachers, with your students? And of course, in the event that COVID hits your school, okay. And in the event that COVID hits your school, as it will, we need to be honest, right? Someone is going to get COVID, or they have gotten COVID at your school. How do you manage it? How do you deal with it, right? So that communication is not something to be hidden. It's something to be made open, but made open in the right way. There are protocols in which we have established to be able to do that. The fourth was learning plans. The point of going to school is not just to take thermometer checks. You know, that's not the only reason why people are going to school. People are essentially going to school to learn, and in the case of staff, to work. So how do we ensure that learning continues despite COVID? So it's been a whirlwind. And as a date, we have over 60,000 teachers that have registered to take the course and that's public and private school teachers. We also have about 18,000 schools or educational institutions below tertiary, approved and unapproved, that took the course. We didn't really focus on approved or not approved for the fact that we know that it has to do with safety. So that was the main bone of contention for us when it comes to safety. So Lagos State was quite successful in getting that done. We went further and we said, schools that submitted really solid plans would earn sort of a consultancy visit to their school with how to make sure that their school was doing very well concerning COVID. And very few schools earned that visit. After that, we decided to create a rubric. Before we started on this journey, there was no rubric because the process was new to us also. But as we went along, we created a rubric which we will make public to you all so that you can look through and ensure and use it as a self-evaluation for your school to see the gaps that about 19 schools came out on top after having earned a visit. And we honored those 19 schools, including a public school across that entire process. Now, why are we here today? Initially, we had COVID guidelines and it was informed by federal government guidelines. The federal government guidelines was informed by Federal Ministry of Education, Federal Ministry of Health, as long with, in addition to other MDAs. So we used that and we made it more usable. We made it much smaller in size. We used that for our training. And then in the initial year, we created volume 1 or version 1 of a document to guide schools. We did that with a safety commission, Lagos State Safety Commission. Now, we've created another one, which has replaced that first one. And this one was updated with the assistance of Ministry of Health and also the Lagos State Safety Commission. So there, it's a better version of the first one and it encapsulates more than the first one did. And that is available for download on our website at www.oeqalagos.com. Okay, so I'm just giving an overview of everything. And so today we have our colleagues from health, consultants in health that are going to be walking you through these guidelines. I'm not sure if they are on yet, but as you continue to make your presentations, as always, for those of you that have been involved with PD with the DG, you know that we always have ways of working. And our ways of working are centered on 3 major components. One is to make sure that there are no distractions where you are so that you can be focused on the content. Be prepared with either a pen or pencil, writing utensil, something that you can use to capture thoughts that may come to your mind as we go along this, this training. Then another thing is to be fully present and make sure that if there are any activities, any questions, that you are giving constructive feedback, comments in the chat box, and that you're asking questions. This is not the place to be quiet or to be silent. This is a place to bring things out to the open, things that we may not even be aware of. Okay, so we do appreciate this time that we have with you all. And we're looking forward to a great session. So Ms. Fazia, can you just inform me if our friends from health are here? Hello?
Hello, ma. Okay. Um, it's Dr. Finney. Dr. Finney, please, if you're online, please let me know if you're online, please, and if you can hear us. Hello, please, Dr. Finney, if you're online, please let me know so that I can just move you up to the panelist.
As we continue this session, I would like to know in the chat box as an icebreaker, what are some of the things you've learned as a school owner or as a teacher from this entire COVID experience? What is something that you've learned? Just one thing that you've learned. If you can just indicate that in the box. Thank you. You all should not be shy. Okay. Ms. Eze Vivian has said precautionary measures, very important, yes. Face mask, washing of hands regularly. Someone has even talked about it being expensive. Yes, I would say if we had to talk about the cost implications of COVID, definitely it is expensive, not just in terms of preventative, the things that are used to prevent it, but really what is even more costly is when people get COVID. That's why it's so important for us to take these preventative measures. right? Because testing, having people come to do contact tracing, loss of hours of staff that have to stay away for 2 weeks. So it is something that when you get COVID, there's a loss at some point, absolutely. We have over 60 people here. We should have more responses here. Shortly, we're going to start with the guidelines, and you going to our website so that you can download the guidelines. So I'm just waiting for Ms. Fauzia to please get us on the website so we can walk.
Okay, DJ, apologies for the delay, everybody. We're just trying to project the screen now, but in a bit it will be up.
Okay, thank you. I like this comment that someone, that's I think Olese, I'm not really sure if I'm pronouncing it well. Apart from COVID or not, hand washing has greatly enhanced hygiene, hence it's a blessing in disguise. Well, yes, in some ways, right? Nigerians, we always find the silver lining even on a dark cloud. So yes, in many ways, it has helped us to be more conscious of our health, and these preventative measures like washing hand, not with water, washing with soap. So yes, thank you for that. Okay, so I'm going to walk us through briefly our website. Our website is oeqalagos.com. It's our official website of the Office of Education Quality Assurance. On this website, you can make complaints. Anyone can make a complaint about anything concerning schools here. That's a separate issue there. We have some things like our Forward to School initiative. Whoops, I don't know what happened. Oops, just forgive me. Let me get back on. Okay. QA Lagos. So on the website, like I was saying before, it disappeared. We have the Forward to School process, which encapsulates everything concerning the COVID-19, where we ask schools to register. That, of course, has been closed, but for schools that want to do it on their own, they can still contact us and move forward with that process. But for the purpose of today's training, I don't know who X19 is, but the video is showing. If we can just if they can get rid of their video. So we have our publications here, and the publications are where you can get our latest press releases concerning the office, calendar, and all of that is there. But for resources, we have many here. Some of them I've already spoken of. So one thing that we have here is the COVID-19 guidelines. I just want to make sure that everyone can hear me.
We can hear you, Ma. Dr. Finney is online, Ma. She's online now. Dr. Finney, good morning, Ma.
Good morning. Good morning.
Okay.
And my sincere apologies for just coming in. Thank you.
Okay, Ma, you're welcome, Ma. Is the entire team here to present, or is it just you?
Just me for now.
Okay, ma'am. So I don't know if you want us to just show the guidelines, or if you want to just share your screen. So I'm sure Fauzia can discuss that with you offline. So I'm just showing everyone how they're able to access the guidelines, okay? So this is available on the website, and it was updated 22nd of September, 2021. So we have Dr. Finney on the line, and she will be going through this. We'll be going through it together. And she's the SSA to Mr. Governor on health. So she's representing the Ministry of Health. Thank you so much for making time out today. So I've shown you how to get to our website. There's no excuse that you don't know where the guidelines are or how to access them. You can access them on your phone if you are not able to print them out, okay? So Ms. Fauzia, please work with Mrs. Finney with Dr. Finney to get her slides so that we can get started on the training session. Thank you.
All right, ma'am. Dr. Finney, I've activated the share screen. If you could share your screen now, or.
Okay, so this is supposed to be a presentation with other facilitators. My duty here today basically was to give the Ministry of Health perspective on the current situation in the schools and to also give a background as to why certain practices which we have observed are not necessarily in the best interest of the entire community ecosystem now, both
Yes.
education ecosystem and health ecosystem. So I'd like to commend all those on this meeting and say, welcome to this. Once you gain knowledge, it's yours and nobody can take it away from you. And to also say that I know and understand and identify that it's been an especially challenging couple of years for the educational system. Want to also commend the schools who have reported, who have tried their best to ensure that they have kept to guidelines that were available prior to now. The guidelines have been updated, they've been standardized in conjunction with the Office of Educational Quality Assurance. Now, the first thing to mention is that Lagos State comes down to local government level. And this is very important for the school. It's important for you to know which local government you are situated in. As ridiculous as it sounds, I think it's a basic thing that a lot of schools need to know. What's your LGA? What's your LCDA? So I would, as an interactive thing, I want everybody to just type the name of their school and the name of the LGA where they are found now, so that I can have a quick overview and see where we're dealing with and if there's a good spread. So if you please just respond in the chat box and tell me the name of your school and your LGA or LCDA as the case may be. So while we're waiting on that,
Dr. Finney, for that. So Dr. Finney has now said that you should name your local, the LGA, right? So this is a quiz for you all. Please ensure to do that quickly so that Dr. Finney could have a good idea. Wow, okay, they know that, ma'am. Please go ahead.
Okay, so I'm very happy to see this. Okay. Muodofin, Mushin, Etiosa, Papa, Ibejuleki, Kushofe. Tito Nursery, where are you? What local government? Okay. Anglican Girls, yes. Okay. Kushofe. Bariga. Fantastic. I am very happy to see this. Very happy to see this. Now, so let's say that Etiosa probably had the largest, not probably, Etiosa had the largest outbreak of COVID and continues to do so for the simple reason that it's the people in Etiosa that are traveling up and down. And when they travel, their children come back, they come to school, and then you have the outbreaks. The second thing I'm going to say today is this. If you know your local government and within your guidelines, you will see there's a structure there. Prior to COVID, it was already in existence. And even beyond COVID, it will continue to be in existence where you have a disease surveillance notification officer. That person works in your local government. And if you have an outbreak, should be, apart from education, your first point of contact. We also have medical officers of health at the local government level who oversee your healthcare at local government level, and their details too should be in that book. And if not, we'll share the list of MOHs with the DG OEQA to share so that you can have an idea who you should speak to when you have those kind of problems. They are not just for COVID. If you have any case of cholera, we have diseases that we call reportable diseases that are significant to public health. So cholera, yellow fever, any case of Lassa fever, any death is a reportable situation. So the state really likes to know and to understand what is going on. Now, the second thing is that please let us stop rushing to close school when you have COVID outbreak. I've seen a lot of that. I think it's just a panic response, and we should stop panicking because it's very disruptive. And then it also stops us from being able to contact trace appropriately. It means once you've closed school, we can't follow up as we should. So we need to be able to follow up. We need to be able to follow up with the students. We need to be able to follow up with where they've gone, who they've been with. And once you disrupt their normal pattern of coming to school, then it becomes a little more difficult. Yes, there's situations where we need to close school, but none of the situations we've seen so far warrant closure of school. That's the second thing. Now, the other thing we now need to do is that we have guidelines of spacing, and we have inspections that are conducted. People should not be afraid. Let's do the right thing so that when we come to advise, to guide, not to shut down. It is not to anybody's benefit to shut down. I've seen some responses here, but these responses are not a reflection of everybody in the room. So I'll please ask everybody to respond to the name of their school and exactly where they are, so I can have a better view. I'm seeing a lot of schools on the mainland. I'm not seeing a lot of schools, a few Etiosas and a few Ibejulekis, but most of the schools are on the mainland. Or DG, are we having mainland only and then island separately?
No, absolutely not. I mean, it does also suffice to say that we do have majority of our schools on the mainland also, though. So it could, that would be reflected. So for instance, Lagoon here is listed here. I also want you to look through and to guide people through the guidelines. There's some very interesting things that you stated.
Yes, I was going to go through the guidelines.
Yes,
after
your presentation. Okay.
Yes.
Okay.
Yes.
I actually want to comment on something you said, man, that I thought to be interesting. You know, that schools are to sort of report everything, including death.
Yes.
Including death.
Absolutely.
You know, and I think sometimes schools are a bit confused because there seems to be so many government parastatals, right? So many MDAs. Where do we go to? Who do we go to first and all that, you know? So that is something that, you know, even as of recently, right? If not that certain things came to the public domain, would we even know? So that's something that I think we also need to think through as a government, what the streamlining of that would be, and then communicate it to our schools so they know in this event, this is what I do. In this event, this is what I do. Yes, I think it's very, very helpful.
I'll also share with you, apart from the list of MOHs, which I'm going to give to the office of your office, and also we're going to share the list of the reportable diseases. And then maybe a little bit of the more common ones. What are the symptoms? What are you likely to see? You know, if a child is absent from school, you want to know why the child is absent from school. It is if a child is absent due to illness, you also should know what the illness was, because some are communicable. So you have a child who has been ill with mumps outside, hasn't been to school for a week. You should know so that you watch out for the other children in class. So if a child has had yellow fever, you need to know. That's a public health, almost an emergency. If a child is down with cholera, and those who have schools on Lagos Island will bear testimony to this, it's almost an annual event. Once the rain starts, the incidence goes up in certain local governments in Lagos, especially, I would say Lagos Island is number one. And so we need to know all this, know why we're having and what we're having and how we can respond, because sometimes it is the school that reports and allows us to go into the communities to now react and say, oh, okay, there's actually a problem here beyond this child that was ill. So it's also an opportunity for a better partnership. I also want people to know that, look, we're in this together. When nobody's coming at anybody with a hammer, all we want is for everybody to work together for the greater good of the children that are in our care. I'll say that as well. So I'm going to go through the document now. And if there are any questions, please make a note of them. And at the end, we can then ask and clarify whatever is not clear and whatever seems ambiguous. So I'm looking at these, and we'll go to the guidelines for exposure, number 9. I know that you've been a lot through your screening. I know you've already done a lot of that. They've trained you in a lot of those things.
Dr. Finney, you know, when we're working with people, we also have to go back to move forward. I would like for you to even take, even if it's you need to take the minuscule things. Let them, I mean, for them to have made time to be here today, they want to learn. So please,
Okay.
let us not assume everyone has
beginning.
graduated.
Let's take it from
Yes,
the beginning.
let's start from the beginning.
Let's start from the beginning. Let's start from the beginning.
Thank you, Ma.
Okay, no problem. And then I'll also say that the screen needs to be bigger so that
so people can see better. Yes.
Yeah, exactly. So just increase the
Please just increase the font, the size.
The font. That's all. That's all. Can just
that plus button. I think. I hope.
On the extreme left. I hope so too. Correct. One more time.
Okay. Yeah.
Fantastic. Perfect.
Okay. Thank you.
So our guideline, very simple to use, and it starts with an outline so that whatever information you're looking for, it's easy for you to find. So please come down. Please scroll down. It covers your Safety Commission guideline. It covers your hygiene. For those who serve food in school, because some schools do and some don't, it covers food prep, why social distancing, transportation to and from school. For those of you who run a school bus service or who outsource a school bus service, it covers screening for COVID-19 and the COVID-19 guidelines for exposure in schools and boarding facilities, managing of cases and all that. So your Safety Commission self-assessment and checklist. And of course, we have references that you can refer to. What are sample collection centers, which are dynamic. So some of what you've seen here, if you get your DSNO on the phone, may be able to give you upgraded information.
Okay, can we please explain what DSNO is?
Your Disease Surveillance Notification Officer. Who is your officer at your LGA? Who is in charge of ensuring the different health cases, like I said, the diseases of public health interest? The person monitors them and reports them to the state. So COVID is a disease of public health interest. Yellow fever is a disease of public health interest. Lassa fever is a disease of public health interest. HIV/AIDS is a disease of public health interest. And the death of a child is a situation of public health interest as well. So the diseases are more than that. And as we go along, we will share the list. So our introduction, stating how the document is organized, the guidelines, they are foundational to minimize the risk of exposure, not just for the students, but even for you, the teachers, and for all the administrative staff in the school. So we know there are different learning environments. We have some schools that are purpose-built. We have some of them that were conversions. We have day schools, we have boarding houses, we have mixed schools, both day and boarding. And they serve as a second home. Learners spend a lot of time in school. So we need to urge extra caution, and we need to take extra care regarding social distancing and hygiene practices. We recognize that it is almost impossible to keep children away from one another. And in doing so, we also need to balance the mental health of the children and their teachers and our COVID-19 practices. Part of what has come out of last year was that a lot of young people have come up with mental health issues from not being able to socialize with their friends, from not being able to learn in a social environment. Therefore, it is imperative for us. I see cubicles with children isolated, and I wonder why, especially when children are not necessarily worse off when they have the disease. Yes, they are carriers, we agree. And definitely we must try our best to maintain hygiene and ensure that sick children do not come to school. But we must also ensure that the children do not miss the socialization that is important at this point of their development. The screen has stopped sharing.
Oh, we'll connect that. Sorry, just got
Okay.
disconnected for a few minutes.
Okay.
Sorry, Ma, if you can go ahead before we join so we don't wait. We're just trying to reconnect. We're using our backup internet now, Ma.
Okay. I think it's back on. I can see.
Can you see my screen? I've shared my
I can
screen,
see
Ma.
the screen.
Thank you. So I will be the one controlling. Okay, so I think you were here.
Aren't I honored that they are the one controlling the screen?
Oh goodness, I'm sorry. I don't know how to get rid of that. Okay, I think I'm good to go. Is that, it should be bigger, right?
Yes, please.
Is that better? Is that better, Ma?
This is perfect.
Okay, Ma. Okay, so let me move down a bit. I think you've covered this place. Please go ahead.
Okay. So we go down.
Okay. Here?
A little bit higher. Or you know what? Let me see if I can download my
it's okay.
own. Okay.
Okay. So,
So
I think you had gone through the
introduction here. So,
yes.
so guidelines.
So, and the actual guidelines, I think is
so what are the guidelines? It's the guidelines are for everybody who works in an educational institution. It's for the leadership, it's for learners, the students themselves should have an idea, for the older ones who can understand, for parents and guardians. And we want to have the roles and responsibilities of institution management and access control for parents and third parties. Please go. So what are the roles of everybody? What are your roles? Because everybody, it's all, when it comes to COVID, it is all hands on deck. It's not a problem for the schools alone, meaning that after this, it may be expedient for you to have a meeting with the parents, to also have an assembly with students or regular updates with students, to let them know what you expect of them concerning COVID-19. Now, I also see COVID-19 as an opportunity. Were we doing health education properly and robustly in our various institutions? Because life is beyond COVID now. COVID is becoming part of what the environment may have to deal with for a while. So What should we do? Ensure that learners and staff are informed, trained on correct use of face masks, one of them. Ensure that self-assessment checklist, which is at the end of this document, is used to evaluate boarding facilities and the entire school for health and safety. Ensure that you conduct a risk assessment and identify categories of staff requiring PPE and provide them with PPE. What's PPE? PPE is mask, PPE is gloves, PPE is hands, and PPE is hands.
I think it's breaking out, Dr. Finn. I'm not sure if it's our internet, but I think last thing I heard was yes, about PPE was the last thing that I heard, ma.
Yes, so PPE is gloves. In this context, it is masks, it is gloves, it is your hand sanitizer. That is all. It is not wearing that white suit. In the context of COVID, your PPE is your mask and your gloves and your hand sanitizer. That's what you need. And of course, sometimes you're going to need a thermometer. We want to avoid large gatherings as much as possible and for a long time. I know that a lot of schools have planned Christmas concerts, nativity plays. If you want to do all those things, you should. It's best to have them outside under a canopy rather than in a hall with an air-conditioned space. And then you find out that you've had a super spreader event where everybody now comes down with an illness thereafter. So you should make separate provisions for sick bay and holding bay. Your sick bay is for general people who are ill, and for holding bay, somewhere where you can keep somebody who you suspect of having COVID. And hostels should also have isolation facilities. Ideally. So what should the learners, lecturers, teachers, instructors, and support staff do? We need to have keep abreast of updates provided by the State Ministry of Health, Ministry of Education, Safety Commission, and Ministry of Youth and Social Development. These are the MDAs, ministries, departments, and agencies that will have updates concerning COVID and all sorts of other things as to your practices. So you should keep up to date and have a good relationship with all of them. Avoid large coverage, gatherings. You said it again. Maintain social distance. Ensure a phased approach to arrival and departure, meaning ideally, you should say that, okay, you want to have primary 1 to 3 arrive between, let's say 6:30 and 7:30, and you want primaries 4 to 6 to arrive between 7:30 to 8:30. School starts at 9. You stagger break times as well. Not everybody going to break. All you are trying to do is to reduce the number of people in a certain area at the same time. That is what you're trying to do.
And I actually wanted to interject here too, right? So what Dr. Finn is also saying, obviously, if you have a small school that can maintain social distancing throughout the day, then this is not applicable, right? But where it is a challenge, then these are approaches that you can use within your school.
Okay. So in teaching the children, you have to teach them how to put on and remove their face masks properly. Even the other members of staff. Avoid direct contact with hands. We're not back to shaking hands, so try and avoid it. Hugging, I know it's not easy. Children want to hug, they want to hold you, but then for other adults, you want to as much as possible. And for the older children, let there be distance. Frequent hand washing. When the children are coming, or use of hand sanitizer, alcohol-based, when children are coming to school in the morning, you do so. Before break time, they should do so. After break time, they should do so. And just before they leave for the day, they should also have their hand sanitizer. Look, when we all do well, when we're all practicing these actions, we're protecting one another. We should observe proper sneeze and cough etiquette, meaning into your elbow. You sneeze and you cough into your elbow, and continue to avoid touching face. Now, another thing is that when children or adults or whatever eventually come down with COVID-19, want to avoid stigmatizing them. You don't want to, zero tolerance for stigmatization. Anybody can have COVID. It's almost, and I can assure you that this particular Delta, this particular Omicron fourth wave is likely everybody will get it. Very likely. I can hear it's not my portion, even though we're on silent. It's likely. So there's really nothing to shame people for. And the school should take up a policy of ensuring that people are not bullied, they're not stigmatized for having COVID. Now, what should parents and guardians do? They should comply. They should ensure that protocols are adhered to at home. This is not a time for people to be visiting you up and down or for you to be visiting people everywhere. Now, as Christmas and as the holidays also approach, you want to also, yes, have fun, but be conscious of where you're going to and how you're going to cope when you get there. Is it a place where you can control your environment? Or is it a place where you are going to be at the mercy of whatever you find there? If it is the second one, the later one, you may want to rethink going there. So if you want to, our parents and guardians are obliged to report any case of exposure of COVID-19 by the learner. And any learner, child that is ill, parents should keep at home. So it is the duty and the responsibility of the school, the institution management to stay informed through reputable sources, not WhatsApp and social media. If you are going to go on social media, please stick to the news from institutions like the NCDC, the ministries, and people who are verified to give information on COVID. Please, let's avoid the sticking spoon on the hand stories. Let's avoid barking like a dog or clucking like a chicken stories about vaccines and misinformation. Double check all information that comes your way before you push it forward. So you have to prepare and maintain your hand washing stations with soap and water within 5 meters of corridors, your entrances, your lobbies, your toilets and bathrooms. You should place alcohol-based hand sanitizers all over the place, your hostels, classrooms, so that if I walk within 50 meters, I should be able to get a hand sanitizer to use. And you should implement the enlightenment program for your learners and for your staff.
Yes, I also wanted to touch on number 2, a committee, a COVID-19 committee in the institution. That is also very important.
Yes, so it's important to have a committee. It does not have to be a committee of 20 people. It can be a committee of 3, 4 people at the front runners and the frontliners of everything concerning COVID-19 in the school. And they are more conversant and they are more in touch and they are more aware. So, but it is everybody's responsibility. But this committee are the heads. Thank you. Please scroll up. Scroll up.
Should I go further down?
Oh, this is fine.
Okay.
So the school, the document says that the enlightenment program should explain what COVID-19 is, the symptoms, how to prevent its spread, and it should also emphasize the importance of when, why, and how to wash hands correctly and to discourage all forms of stigmatization and discrimination. Now, schools should ensure that deep cleaning and disinfection of the entire school's premises is done regularly. And for this, I would like to say that regularly means for the entire school, it should be a daily event. Excuse me, please.
So Dr. Finney was talking about how the cleaning should be frequent and how it should be daily. So it's not that you're doing it maybe 2-3 times a week. No, you should, especially those areas of your school that have frequent interface with the public. So we've listed railings, door, window handles, toys, teaching and learning aids, and all of that. Then ensure that trash is removed daily and disposed of safely. Okay, so that means doesn't just put in trash, put it in, ensure that you have the right means of disposing of the trash. So it is not just all over the place. And then that can even have another set of issues that will come as a result of that. Then ensure that the school principal procures sufficient quantities of hand sanitizers, soap, disposable cleaning materials, and all. I mean, I have a personal story, not for a school, in fact, for a health facility. My daughter wasn't feeling well and I went to a health facility and I went to the restroom. They told her to get a sample of her urine. No sanitizer, no soap. I was livid. I said, how can a health, facility not have these things? Non-negotiable, especially during this time. So soap is very important. There should never be a situation where you run out of soap, never. So you need, that's why part of the training that we had given before is to give people that responsibility to check up, to make sure that the soap, sanitizers are all filled up and they don't run out when people need them. In a case where some people don't have running water, ensure that the buckets are filled with water. And then I would also say even masks. You see people, they wear masks. Some people will use their disposable mask. You're doing yourself in doing so. Masks are not to be worn multiple times. It's supposed to be disposed of that day. And if it falls on the ground, it is to be disposed of. You see people, the mask will fall on the floor, they'll pick it back up. No, that is not sanitary in any way, shape, or form. So it's really important for the school management to realize, you know what, we're working with children, it will fall multiple times. But if people don't know that they're not supposed to do that and they can come to you, they won't do it. They'll just be using masks that are falling multiple times on the ground. So it's also the responsibility of the institution to ensure that there is a culture within that school where people know that, okay, if I've lost my mask or if it's gotten soiled, I can just go and get another one, okay? Learners of staff with high-risk conditions, so those people that have pre-existing health issues or whatever other issues that has been identified as high risk, they should be offered alternative means of learning, remote, online. Okay, we definitely do not want to compromise the health of any learner or any staff, and we really need to be honest with ourselves about that. Dr. Finney, are you back? I think I'm hearing something. Okay.
I'm back.
Okay, please go ahead.
Please scroll down.
I think I had stopped there.
So access control, this is not a time for all manner of people to be coming into school. This is a time to keep strictly to only essential visitors in school. So you should ensure strict access control measures, and access control measures are many. If you don't want parents to come to school, then you ensure that drop-off is not within the school compound as much as it is possible. Also, you need to enlighten them that from now on, we're not going to be allowing parents to come into school for certain reasons. So all visitors should also sign in. In case there's a problem, you'll be able to trace people. Now, all visitors except government officials need to book an appointment. And we say except government officials because sometimes we conduct spot checks and we cannot give you advance notice that we're conducting a spot check. So you should, to avoid parents also coming to the school, it is good for you to communicate with them often. If you don't communicate, then they have to come to school to ask the teacher, what could have gone out as a newsletter or an email or a text message. So if you don't communicate, then you will have problem controlling them even at reception. Then you have a rowdy reception where parents are shouting because they lack information. So these are the measures by which you can control access to parents and all visitors. As much as possible, if there are repair works, they should be carried out outside school hours. Next. For those that have hostels, ideally, hostels must not contain more than 50% of their capacity. A high level of hygiene must be maintained at all times. And wearing a face mask is compulsory for all learners, teachers, and support staff. A register containing names of all boarding house learners must be marked on a daily basis. And sharing of food and drinks using personal eating utensils shouldn't be allowed. So sharing of cutlery and crockery is not allowed. So in case you have any learner that does not possess, please provide something for that person to use. The toilet facilities should be cleaned multiple times daily, and you must use an infrared thermometer for regular temperature checks. Hostels should have a boarding bay manned by a registered health professional and have adequate links to emergency services. Definitely, if you have a hostel, there must be running water and hand sanitizer in there. And any learner showing symptoms of COVID-19 should be isolated immediately from other learners and should be given adequate medical attention. So hostels should be decontaminated in preparation for each term, midterm. If your hostels also have exits or public holidays that the children go home, as often as possible. So use of air conditioners should be discouraged, but the nights are getting very hot. This may be difficult because you will need to balance this with the parents that are going to have a go at you for keeping their children in a hot environment after paying such a large amount of money. All hostels should follow the most updated recommendation from the task force, COVID-19 task force in the institution for testing, isolation, and safe reopening. And you should appoint a COVID-19 manager to make sure that at least there's somebody who is absolutely responsible for all COVID-19 activities. So learners' hygiene and safety tips. Learners should be encouraged to wash their hands frequently. They should refrain from touching their face. They should not share utensils, cutlery, or crockery. They should sneeze into their or cough into their bent elbow or tissue and dispose, and then wash their hands. They should refrain from teasing anyone about being sick, zero tolerance, and then share what they learn about preventing diseases with their family, friends, and siblings. It is instructive to note that most diseases can be prevented and their transmission prevented by keeping basic hygiene. Once your hands are clean, a lot of diseases cannot affect you. If you sneeze or cough into your elbow, you are not likely to spread your germs to other people. So those are some of the practices that go beyond COVID and apply to everything. Good hygiene is key. So what should teachers do? Same as the students, wash hands, and all those other things. Next, please. So we have instructions here on how to wear a mask. We should really wash face masks daily. Wash in warm water, rinse and dry in sunlight. It's better because the UV rays in sunlight actually kills germs. So you iron mask and you keep, well, don't put your mask everywhere. Keep your mask safe. Remember that it's going to come onto your face. So I have Dr. Naima Balogun in here. I would advise it, we're on page 11 of a 39-page document. So I'll just run through the rest quickly so that Dr. Balogun can come up and tell us about risk communication, because a lot of what we're going to do is to advocate. We're going to advocate to our colleagues. We're going to advocate to the students. We're going to advocate to the parents and other stakeholders within our educational environment. So it is important for us to know what to say and how to say it to the different audiences. So screening, that's another issue. Certain schools are screening every day. And I'm wondering, if you look for something, you'll find it. It is not necessary. If you have a child who is showing symptoms, or if you suspect that a child has COVID, then you can test that child and test those who are immediately around the child. Number one, you start from the children sitting around that child. The 4 children in front, behind, and on the 2 sides. Now, if those children test positive, then you test the remaining children in that class. If there are senior classes and you have other, meaning like in senior classes, I know you have a homeroom and then you have subject rooms where you have children from other homerooms, then you may need to test a little bit further. But this practice of just randomly testing people up and down, really, we are not sure the merit of it. I know that it is done in other countries, but then what it does is cause disruption. So I think that for now, we should be very conservative with how we test. We should test if we have reason to do so. If we're going to do random testing, keep the numbers low. Keep the numbers low and rotate the testing around the entire school. So, but screening is a daily thing. You take temperature every day. You take temperature every day. And if a learner is unwell, the child should be sent home on arrival. So it also means that your arrival should be planned and processed in a way where you can actually take the temperature of the children that are coming to school. If 10 children arrive at the same time and you have only 1 person, then there's no way you can screen effectively. You're going to miss people out and it becomes an almost pointless exercise. Your screening is more important than your testing for COVID. It's more important for you to be screening, checking the temperature, than to start. So it is important for us to know this. Everybody also coming into the school now, not just the children, all teachers too, all visitors, anybody coming into that school facility should have their temperature checked and should have a face mask on, covering their nose and their mouth. There's a lot of mouth mask wearing. Please scroll up. DG, please scroll up. Thank you. So if a child is showing symptoms, maybe during the working day, let it come back down, please. If the child came to school with a low temperature and somehow within the day started having, for example, a higher temperature and is coughing or complaining of a sore throat, then the child should definitely have their mask on. You find a place to isolate the child, a designated holding bay or sick bay, or a designated isolation zone, not a place that is dangerous for the child. You don't want to put the child in a place with chemicals or fumes or poor ventilation. Please ensure that wherever you're isolating the child, is a place where the child can be supervised, either through a window, and it is safe. Please immediately inform the parents and guardians or caregivers of the child and request that the learner be collected. Even if it's a boarding house, sometimes you want the child to be collected because sometimes these things progress faster than what you could imagine. So you provide the parents or guardian with information on what to do. You should tell them what to do. You suspect it is this, and this is what they should do, and who to contact if symptoms worsen. So you ask that the learner's symptoms be monitored at home and allow the learner to return 10 days after the positive test. 10 days after the positive test. So we assume that the learner was taken home on Monday and did a COVID test that day. The result came out on Tuesday or Wednesday, and it was positive. 10 days from Tuesday or Wednesday, the child can come back to school. Nobody should ask anybody for a negative test. A negative test is not required because the science says that 10 days after the positivity, the person is no longer able to transmit the virus. But the person may still test positive due to certain other physiologic things that we'll not go into. I hope others can hear me clearly. If you can, please just type yes in the box. Because I can see somebody asking about volume here. Oh, fantastic. Thank you. And please, I have a question. Do we need a negative COVID test? Do we need a negative COVID test after a child has been ill with COVID? In the chat box, please.
Okay, are you asking the group?
Yes, I'm
Are you
asking, do we
quizzing
need a
them?
negative
Okay.
COVID test after a child has
Are you
been
asking
ill?
me or are you asking the group?
The group, please.
Okay, I should not answer. Okay.
Okay. Good. I said no, Dr. Finney. I didn't say no. I am telling you that it is no. Mrs. Bakari. So I'm going to say it again. A child does not need a negative COVID test to come back to school after the child has had COVID. What you need is 10 days after the child tested positive. The child
Dr.
can
Finney,
come back to
I just
school.
for clarification purposes, if you could not just be just for the child, but also to staff.
Sorry,
that
to
also
staff
have
as
COVID.
well. Everybody.
Yes.
Everybody. Once you have the person tested, child, adult, the person tested positive with a test, proper, not the rapid test, PCR, not rapid test now, because PCRs have a certain level of accuracy and your rapid tests have another level of accuracy. So the one that you're going to do at the lab, it was positive on Monday. After 10 days from Monday, which is the upper Wednesday, the child can come back to school. And the teacher can come back to school. The teacher, the other member of admin staff can come back to school, please. Now, testing of children on resumption is good if you are in a closed boarding environment. It is good. Know that, okay, people came in, but no, two things. The first is that COVID has an incubation period. A person may test negative today and come down with COVID in a few days, which is why when you go to some countries, they ask you to isolate for 10 days to 2 weeks. The second thing is that testing also is as at that moment. So if you are not in a closed boarding environment, it's neither here nor there. because people are going to be going home and coming back, going home, but going to other places, coming back to school, children going home, coming back. So you can test to know, but it really doesn't confer any sort of protection. What confers the most protection are the practices that you carry out whilst everybody is in the school environment. The washing of hands, the use of hand sanitizer, the use of the face mask, the cough and sneeze hygiene, the monitoring of temperature. Those are things that confer, and the social distancing. Those are the things that confer a higher level of protection. Now, while we're screening, we want to screen people who are going to come back to school. Or, okay, the screen okay. Do you have, these are questions. Do you have a fever? Do you have a cough, sore throat, difficulty breathing, weak and tired? Because COVID presents across a very wide spectrum of symptoms. These are some of them. Please scroll up. No, the opposite direction. Loss of taste, loss of smell, headache. Now, also contact tracing. Have you been in close contact with a suspected or confirmed case of COVID-19? So if the answer to all the questions is no, the session can end and the learner or staff permitted to enter the school for a temperature check. Now, they've given you the baseline temp. If temperature taking is higher than 38 degrees, then it's cause for concern, so that we're not just pressing that temperature button, we actually know what we're looking for. Okay, please go on. So we recognize that it's not easy to social distance in the school environment. So like I said, all the other things I've listed are protective as much as possible. If you have the space, distance. If you don't have the space, then you do the best you can with the space you have, and as much as possible, you reduce over interaction. Next, please. Okay, so if a learner or a member of staff appears ill or is displaying symptoms, you should be, so testing is two-tier in Lagos. You have the free test and you have the paid test. For somebody displaying symptoms, they can access free testing at the mainland hospital in Yaba. Free testing at the mainland hospital in Yaba. But for those who don't want to travel that far and have the means to do so, they are free to walk into any of the COVID-19 testing facilities across Lagos. COVID-19 testing, the laboratories, they have 20, they are up to about 30 now. So while that individual is taking that test, because that test often takes 24 hours, all the contacts, you start with the, well, if it's a teacher, the classes that the person has taken. If it's a student, the other students sitting with the child and teachers that have taught the child, and so on and so forth, even up until home. So if the case is now confirmed with or without symptoms, the school management has a duty to report to the State Ministry of Education and the LGA MOH by submitting an incident report. An incident report is, I think, is further down. The incident report containing information pertaining to the case as contained in the case investigation form. Please scroll down. Okay. So, like I said before, they can stop isolation and return to school after 10 days. Both teacher and students or both worker and students. An environmental decontamination subsequent to the outbreak should be conducted in everywhere that the student or the school administrator or the teacher have been in preceding 3 days. So 3 days before the person tested positive. If you had physics, we have to clean the physics lab. We have to go to the home economics room to clean there. Everywhere the person has been for 3 days before they tested positive needs to be decontaminated. And closure should be authorized in conjunction. If you want to close school, please notify the Ministry of Education, notify the Ministry of Health. Please scroll down, and then we can advise on closure or non-closure. No more willy-nilly closing of schools. Please scroll down. DG, please scroll down. Okay.
The team has taken over the scrolling.
Oh, okay. Okay, good. So a cluster may indicate a breakdown in the COVID-19 strategies. Even though you've tried your best, sometimes these things will still happen. So early identification and corrective steps can contain and prevent further transmission. And we must identify all clusters and notify what is done for as same as for individual positive cases, and improve the implementation of the COVID preventive strategy. So when we have outbreaks, we go and review the school and their practices and see where there is a gap, if any. So we'll trace as much as possible the contacts of the positive case, and a contact is somebody who has been in close contact 2 days before and 14 days after the start of their symptoms. Contact tracing should be done to identify those exposed to the individual. So it could be the school management has a duty to report. Please hold. So let's just scroll through all this. Contact tracing, meaning we have to look for line lists, a list of all the contacts. Please, let's scroll down. Down. And then there's secondary, primary contacts and secondary contacts down. So exposure categories are listed in here. Down, please. Just keep scrolling. So communication is key, please. Communication is key. It's okay to have an outbreak. What is wrong is to handle the outbreak wrongly by not communicating either with the Ministry of Health, Ministry of Education, or your OEQA. Please, if you have a problem, there are no penalties for having COVID in your school. There could be penalties for not handling it properly. Please scroll down. So we have sample communications, and environmental decontamination should follow, because you don't want people to come in contact with people who had not been in contact before. If you had done a contact tracing and you have the immediate contact, you also don't want it to go further with contaminated surfaces. So you want to decontaminate if you have an outbreak. Like we had said before, everywhere the person had been to 3 days before the person tested positive, we need to decontaminate all those areas. And you need to do deep cleaning of the school often. Fogging and spraying of humans is not allowed. It's harmful. Spraying outdoors is wasteful. So your COVID-19 is on the surfaces where human beings are inside. So testing guidelines. Regardless of level exposure, it is advised that symptomatic exposed persons be tested with priority given to the categories. Symptomatic learners and staff are at high risk of developing severe diseases, and symptomatic learners and staff who are in regular contact with people who are in high risk of developing severe disease. So it is those who are at high risk, those who care for, or those who live with those who are at high risk that have priority for testing. Symptoms of COVID-19: fever, continuous cough, difficulty breathing, sudden onset of loss of smell, sudden onset of loss of taste, altered taste, sore throat, runny nose, headache, muscle or body ache, new onset of confusion, nausea, vomiting, or diarrhea. You can see it's a very wide range, and not everybody will have everything, and some people will have nothing at all. Asymptomatic people identified as high risk can be considered for testing. However, if testing capacity is limited, this is not advised. So what this now lists what you should do at levels of exposure. Please scroll down. So this is the summary of the exposure management as already stated. Please scroll down. Okay. So closure presents a disruption to the delivery of education is not warranted if it's a single individual or confirmed COVID-19 case, if the person has been left in the classroom for less than 2 days or less while infectious. In these cases, direct or close contact need to be identified and managed appropriately. Environmental cleaning and disinfection can be done while schools activities continue. Now, so following the recognition of a cluster of cases where over 25% of the class are suspected or the school and confirmed to have COVID-19, it may then be appropriate to temporarily close a bubble, a class, a grade, or a section of the school to quarantine or isolate. Careful consideration must be made to ensure that the aims of the containment can be achieved without closure. Closure of an entire school is considered an extra measure that should be carefully considered and can only be made in discussion with relevant authorities. Please stop closing school. So the contact details for your LGA, disease surveillance officers. If you have a problem, these are the people you should call first. And each LGA has one. And you can see your list here. Some LGAs have more than one. Please slide up. This document has been shared, so these are some of these some of these locations are no longer taking samples. So I think the safest is Mainland Hospital in Yaba, Mainland Hospital Yaba, and then NIMA. NIMA is also in Yaba, Nigeria Institute of Medical Research. So notification, Ministry of Health. These are some useful numbers. Scroll down. So we also shared some checklists for schools and boarding facilities. Please scroll down. Please keep scrolling. Okay. So we're down to the end of the document. Please keep scrolling. These are just the references for a lot of words. Okay, ladies and gentlemen, on that note, I think we've come to the end of the document. And if you have any questions, please put them in the Q&A. Okay, so Aduke Obefabi says, how do we get access to the information I'm sharing? It's a guideline and it's on the Office of Educational Quality and Assurance website, I believe. DG, am I right?
Yes, it's www.oeqlagos.com. I'll put it in the chat box now.
Fantastic.
For download there.
Okay, I'm going to hand Dr. Balogu. Are you still here?
Yes, I am.
Okay, so I think maybe you take over. If there are no questions, because I can't see any, I hand over to Dr. Noimo Balogu, and have to ask you to excuse me. I wish us fruitful deliberations. I wish us a very Merry Christmas.
Dr. Finney, please, I sent a document to you. Could let me send it to the organizer so that I could just
Okay, I'll do that right away so that they can share it on their screen for you.
All right.
Okay, somebody is asking the difference between a PCR test and a lateral flow test. Okay, so PCR is polymerase chain reaction, and it's a test that checks the DNA of whatever organism, the virus in this question. It's a test that has multiple steps carried out with complicated pieces of equipment in a laboratory. And it is more specific, it is more sensitive for those who are science-based here. So it's a specific and sensitive test that we use for COVID-19 and some other organisms, but in this case, we're talking about COVID-19. Now, a lateral flow test is that instant one that people do that almost looks like a pregnancy test, a small white plastic box that people take their own sample, usually self-administer. You take the cotton board, the long cotton board, you swivel it around your nose, you swivel it around your throat, you put it in a little bit of liquid and you test it yourself, or you go and buy it in a pharmacy and conduct the test by yourself. So that's the difference. Now, the lateral flow test or the instant test or the COVID testing kit, rapid diagnostic kit, as it is also called, is good if you want to quickly know something, but it is not as specific or as sensitive as the PCR. The PCR is a lot more accurate, generally. And even with the rapid lateral flow test, their qualities vary. So it may also depend on the kind of test you are using. Some are better than others. So if a rapid diagnostic or a lateral flow test is positive, it is always good to do a PCR test not always good. It is mandatory and it is necessary to do a PCR test to now confirm or otherwise that the test is positive. So that's the difference. Ajibike Bakari, that's the difference between a PCR test and a lateral flow test. Yeah. So I hope I've answered your question. Okay. So I'm going to hand over back to the OEQ team. I'm going to forward Dr. Balogun's presentation right away to Is DG still on the call? Are we still in the... Is DG still here?
Yes, DJ is still online. I guess she just needs to unmute her button.
Okay, so I'm sending the document over to her now. Or where do you want me to send it over to?
Ma, you can send it to Mrs. Oshobu.
Okay, all right. Done.
Okay, Ma. There's a question in the chat box about spacing. Somebody wants to know how they can manage the space in their classroom.
I think the guideline now is 1 meter. We've come down from 2 to 1 meter. Any other questions before I have to dash? I've answered. I've answered the question on spacing. 1 meter. I think we're still taking 1 meter. We're down. We started at 2, we went to 1.5. Now we're at 1 meter. 1 meter is we're at 1 meter now.
All right, Ma. We just want to thank you before you leave. Thank you so much for the time and that you've explained in details the guidelines. And I'm sure the participants are really gotten a lot from what has been discussed today. Thank you so much, Ma. Before the other doctor, I didn't get a name, before Dr. Rahim.
Dr. Noima Balogun.
Okay, Dr. Balogun, apologies, before she comes on board. We just want to thank you for the time you spent here with us.
You're very welcome. I wish Merry Christmas, eat gently, drink gently, and go out even more gently. And we pray, we have made it this far. We'll make it further. I pray for everyone's safety over this period. Please, please, please stay safe, reduce the movement. Take care. Bye-bye. Dr. Balogun, over to you.
All right, please, can I start? My lecture is a very small one. Can I start?
You can.
Okay. Yes, good afternoon, everyone. It's been a long day, apparently. So I'm just going to discuss the risk communication with respect to the guidelines in school. And basically for me, it's mainly about trying to talk about the essence of communal awareness. Whether we like it or not, Nigeria is a multicultural society where a lot more people than the family or the school decide in terms of interventions. So please could you go to the next slide? Yes. So why communal awareness? Communal awareness because the school is a community on its own. And not until we understand that the school is a community where we have different sets of decision makers, then when it comes to safety, we may not be able to get, like to go far. The school is a community where we have the parents, we have the teachers, we have the people that form the workforce, the security men, the staff, in the school, the cleaners that would have to go to their own different, communities. And we also have the management and the students or pupils themselves. So eventually there's a need for us to be able to understand that communal awareness, looking at the situation of COVID-19 now, is a type of social skill that focuses on understanding the collective norms, beliefs, and practices that would influence the guidelines that we've been talking about since. No matter what we do, if people are not going to adopt the safety protocols, then it won't happen. We need to have a way of making them to understand that this is a collective discussion. And how are we going to do this? We understand that we are all different people in terms of stakeholders, and we would need to engage the different level of decision makers one by one. Decision makers, we have the parents, we have the social peers, we have the religious leaders, we have the people in the school themselves. Next slide, please. So eventually, when it comes to COVID-19, when it comes to the guidelines in school, when it comes to school safety and school continuity, despite the pandemic, then it's a collective decision, and we would need to all play our different parts. And so that is why this picture is there. It takes everyone. In playing the different parts, then we need to, the next slide, thank you. In playing the different parts, then we need to understand different perspectives. And so I asked the question, whose lens are you using? Remember that we have some set of school owners who believe that COVID was something that the government decided to do to cripple the private education. Some people believe that, oh no, COVID is something that the politicians are using to collect our money. Some people believe that, oh no, I've seen cases of COVID-19. It has happened to my family. It has happened to friends that I know. It has happened to members of the management that I know. So indeed, COVID-19 exists. So which particular lens are you going to be using to engage people in your own school community? And this is very important. If you as a school owner does not even believe that COVID exists, then there's no need or there's no way you're going to engage people with whatever guidelines that they put, because you do not even believe in it anyway. So we need to understand the lens that you would be using to be able to have this discussion going forward. And in understanding this, then we would understand the problem-solving skills. When we are able to understand that, oh, indeed, COVID exists. Indeed, we've seen people who came down with the symptoms. Indeed, if we're able to kind of like live through and follow the safety protocols, is going to be a plus to our own school in terms of brand positioning, in terms of image. If we decided not to do it the right way, and peradventure 2, 3, 4 people come down with COVID in our school, is also going to affect our school's image, we would then begin to understand that we're actually problem solvers in this discussion of COVID pandemic in the school community. Next slide, please. And so in building that confidence, we need to start with, the confidence of saying you love yourself. If you love yourself, you are going to make sure that you protect yourself. Now, if you love people around you, then you protect the people around you. So you're going to have to love yourself first and love people around you. Next slide. This takes me to where we are going. Now, risk communication in schools. Risk communication in school is a strategy in which an individual group or organization maintains a continuous level of engagement with its intended audience. Now, who are the people that are going to be your intended audience now? We have the pupils themselves. We have the parents. Remember, Dr. Finney was talking about the need to be able to have a place where parents drop their children, which is relatively at the level of distance from the school, from the school compound. So parents are going to be part of your audience too. Your own people who are going to follow the school bus, your school drivers, your school cleaners, your school cooks are also part of your audience. Your teachers are going to be part of the audience. So we need to understand how to engage these people. Now, as a way of wrapping up, I always tell people based on risk communication in a communal community like ours, what we do is to use the Owambe kind of model. The Owambe kind of model is one that looks at Ashebi. What usually Nigerians would say is that you do not buy Ashebi, then you do not take part of the Lajis in any party. So one of the things we would have to do is to be able to do more of recognition in engaging people. Imagine us having ambassadors in the different classes. People who, after we have been able to teach the children about songs on COVID-19, about poems, we see that those children, they are always very, very enthusiastic to wash their hands. They are always ready to use their face mask. They are always ready to kind of like stay at a little bit of distance from their classmates. We could choose some of those pupils and make them to be ambassadors. Ambassadors, and we choose these class ambassadors and class leader when it comes to COVID-19 every month or every week. When a child is chosen this week, trust me, by the time that child goes home, the other child too will want to be the class leader for COVID-19 prevention by next week. It becomes a healthy competition. And before you know it, everybody is working out to wash their hands. Everybody's working out to, kind of use their mask. Same goes for the teacher. The most compliant teacher of the week for COVID-19 prevention, the most compliant school cook of the week, the most compliant security guard, the most compliant, parents that ensures that by the time they're dropping the child, they are in their mask, they wash their hands. When we begin to, and it just, the only thing it does is just a bit of putting their picture right at the, at the entrance of the school and having their name as compliance. Why do people buy a Shoebi anyway? It's for recognition, to have a sense of, oh, we are part of the people that know the celebrants. Can we begin to adopt this model too in engaging our stakeholders in schools? So when we have those kind of compliance and recognition, and maybe once every month, we recognize the most compliant class, where they ensure that they wash their hands, where they ensure that they use a face mask, where they ensure, and as you are doing these things, you're also showing it in your school's websites. You're showing it in your school's social media handle. And I think that is what the Office of Education should also do. Let us have a social handle where some of these schools can show some of these videos and some of these pictures. At the end of the quarter or at the end of the term, we have the Office of Education also recognizing some schools that have been most compliant when it comes to COVID-19 safety protocols and preventions and following of the COVID guidelines. This would also be part of the things that the Office of Education can promote. I don't mind having to work with them in ensuring that we have a desk office that will get this done. We have a desk office where they can send those pictures. We collect these pictures. It becomes a form of data. When the Office of Education is also presenting maybe to all those annual discussions, sustainable development goals, education summits, they would have those kind of data to back up their engagement with the different schools. So the schools benefit with the recognition. The students and the parents and the stakeholders in those schools also benefit. And the Office of Education also benefits by being the hub for this data collection. I am a researcher, and I believe that whatever areas of impact in the areas of engagement that we do, there should be data to be able to showcase this impact. That is when it is trackable. That is when we can follow this data to the core. We can present this data as Sustainable Development United Nations goals done by the Permanent Secretary or the Commissioner for Education or Commissioner for Health. So at the end of the day, it becomes a win-win. I'm going to stop by saying that risk communication and engagement in schools, in markets, everywhere is going to work when we make it a win-win situation. A win-win when the beneficiaries that are going to follow the safety protocols wins in terms of recognition, and the enforcers or the people that develop the guidelines and all of that win in terms of data collection and social reporting. Thank you very much. I hope I've been able to engage. And so as a form of recap, I've been able to talk about the need to be able to have, can we have some jingles? The Lagos State COVID risk communication pillars has some songs for primary schools and all of that. Can we turn some of those things to jingles, simple children's jingles that can be played in these different schools? Can we then have a desk office where they can have the submission of their poems, submission of their videos while trying to, follow the safety protocols, while trying to, be compliant with these things? Can we have a form of data that can be followed to be able to track the different impacts in all the participating schools at the end of a quarter, at the end of a term, at the end of the year? I think by the time we begin to have these proactive measures towards risk communication and engagement, it would be a win-win for all the different stakeholders, whether at the individual school levels, whether at the Office of Education level, whether at the Lagos State government level, whether at the level of the national productivity in terms of COVID-19 engagement. Thank you very much. I am Noimot Habisola Balogun.
Thank you so much, Dr. Balogun, for that insightful presentation. We can see comments in the chat box. A lot of participants are just saying thank you, that they've learned a lot. Taking a few, okay, we've enjoyed this discussion, very educative, very reward system, and so much fantastic review from our participants. And on that note, we are going to call on our final facilitator, Dr. Bisola Adebayo, to give us our own presentation. Dr. Bisola, are you online now? Can you hear us, please? Okay, is Dr. Bisola Adebayo online? Dr. Balogun, please, can you confirm to me if Dr. Bisola is online?
I do not know who Dr. Bisola Adebayo is. I figured that Dr. Finney would have called her from another, unit of the communication pillar. Yes. Okay. Yes. But let me try and call Dr. Finney if she would give me a number so that I can.
Okay. I can see she's online, but she just needs to unmute herself, I think. Dr. Bisola.
Do you have a number?
Well, we'll try to get, we'll communicate with her. Okay, so while we are with Dr. Bisola's response, if you have any questions, please let us have it in the chat box, and Dr. Balogun will be glad to answer your questions. Okay, we're yet to see questions in the chat room, in the chat box. Questions, comments on this is an opportunity. The experts are here. to give you answers to some of the questions that you might have for your school. Okay, so I can see a question now. If Dr. Balogu will please oblige us. Please, how do we handle below 5?
Yes, so, all right, thank you very much. I read the question. Yes, of course, we know that when it comes to health, it's easier for you to be able to engage, people that are much older teenagers, people from 10 years and above. However, when it comes to children, what works best for them is role modeling. Role modeling, and this is where your teachers also have to be fully engaged. So one of the things that you do is to have very creative graphics that are relatively colorful and shows what you want these children to do. So when you have the place where your basin is, your wash hand basin is, you have a very colorful picture there of a child saying, wash your hands, and showing it, So sometimes we underestimate, but I also have a 5-year-old, and I know that sometimes what he sees in cartoons, if he wants to wash his hands, he tries to remember what he sees in cartoon much more than what you tell him. So we need to also then recreate these cartoonic characters. It could be a Princess Sophia or a particular cartoon that we know that. So before we even do the graphics, we could ask them in class on the assembly, which is their favorite cartoon. They will tell you maybe like 2-3 names, and then we could then now recreate graphics using those things to be able to then show, how to wash their hands, where to wash their hands, and how to use their face mask. Those are simple, but trust me, role modeling is what works best for children less than 5. No matter how much you try, they tend to have very low attention span, so they may not be able to just, follow through. However, when there are pictures that tell them, oh, this is it, and they see those pictures, and the pictures are people that they have a natural lingering moment with, in terms of cartoon, it works. I hope that answers the question.
Thank you so much for that in-depth response. Though there's one more question, but I think Dr. Bisola Adebayo is online now. Dr. Bisola, can you hear us now? You may need to unmute your mic. Okay, while she joins back, let me just quickly read the last question I saw in the chat box. Someone said, some visitors to the school don't want to use face or the nose mask. What do we do in such situation? Do we
like I mentioned, let me quickly answer before Dr. Bisola comes online. Like I mentioned, one of the things that works for Nigerian adults, and trust me, I'm a social researcher. This is what I have, what's the word? I've worked on, and I've seen the findings. One of the things that works for Nigerian adults is recognition. For the ones that follow those principles, take their pictures and put them as the most compliant parents. Most compliant parents for the week, and continue changing it based on their compliance. A lot of times they would follow suit. A lot of times, and at the end of the day, if you've tried everything, whether we like it or not, these people, they follow protocols when they travel anyway. And so we would put it there as part of the things that we do is love. And if you love us, you would listen and follow our safety protocols. When we train, if you want to go into the bank, no matter how, no matter how aggressive you are, the teller is trained to be able to, continuously tell you, oh, sorry, sir, we would do what you want now. So let us continuously train our security guard not to be rude. However, they should still try and insist on them coming in with a mask. But I think that recognition is something that can work, usually works. Thank you.
Okay, thank you so much. Sorry, I was trying to unmute myself. Okay, so if we'll have Dr. Adebayo's presentation now. Dr. Abisola.
Good evening, everyone. DG OAQA, thank you for having me and all the members of the team. I'm very happy to be part of this, and I'm happy for all the work that has gone into the guideline for schools. I think Dr. Efini, the SSA, and Dr. Balogun, they covered a lot of the key reasons why we're here. And I just have a very short presentation because I think that was the core focus. And it's just to remind us that COVID is still with us. So I'll be sharing my screen, and I just want to give us a brief surveillance update and just to remind us of the things that we need to do. So I'm sure I will not take more than 10 minutes of your time, God willing. So let me go ahead and share my screen.
Oh, you can.
Sorry, I'm trying to share my screen.
Okay, you can also send the document to me. Let me share from my own end.
All right, let me do that. Please just give me a minute. I'll do that. Thank you, everybody.
Okay.
Please just give me a few minutes for that. Hello, Ma. I got your message. Yes, it's been a very short presentation. I think I'll talk more to the slide. Have you seen the slides, Ma?
Yes, I'm just downloading it and then I will share it in a bit.
All right.
But you can go on with what to expect from.
Okay. All right. So I'm just going to just go over what the current situation is. It's going to be a very short presentation, like I said. So currently in Lagos State right now, in fact, cases are rising rapidly. I was telling people that in November, we're a bit late back off wave. In the first week of November, our cases were like 1, 2, 3, 4 a day. We did not even achieve 10 cases every day. But I tell you, the presentation I'm showing is like the night before the last, but as of today now, daily, we had 1,176 cases. So it's rising rapidly. And what we've noticed is that it seems to be more effective, and the incubation period seems to be on the shorter side of the spectrum. However, the good things so far, and I say so far because like what they say that for the variant, it's too early to say, oh, it's mild. So far, the good thing in Lagos State is that our admissions are not yet rising as much. You can change the slide, ma'am. You can move to the next slide. So the good thing is that admissions are not yet, next slide, ma'am, rising as much, but it's still rising rapidly. So what we are seeing is the trend of cases that we have. What we are seeing right now on the screen is the trend of cases that we have had between November 1 and December 13. It's a little earlier because labs usually post results at different days, and we work on the dates the person was tested, not the date it was uploaded. If not, it will give us a false representation. So colleagues and dear friends, you can see at the beginning of November, we were having really few cases. And you can see the sudden rise towards the end of November to 494, 521. And I tell you, the result that we are giving today, we've hit 1,176 cases as at now. And that is quite alarming. In fact, as of today in the hospital, people were finding it difficult to get Amatem to buy in pharmacies. They said the pharmacist will say, the rate of malaria is too high. And I said, it is not malaria, it is COVID. So people have to be aware it's really spreading. Even in our own center, people have end of year party. Next thing, you start seeing people that have COVID. So it's something that we really need to take seriously. It's spreading and it's spreading fast, but I thank God that many people are having mild cases. So even people that are fully vaccinated are having, but the good thing is that most of them will have a flu and then it will subside. So we're in our first wave. Next slide, ma. Now you can see the distribution. Usually we generally tend to have more cases amongst the males. So cumulatively, we can see we have 54.9% of our cases amongst male, while 44.7% are amongst female. There are always a few that we may not be able to get their data. Next slide, ma'am. And one thing we notice is that women tend to, sorry, apologies to the gentlemen and daddies here, but women tend to be more proactive about their health. Once a woman is ill or the child is ill, they get to clinic. But men, they feel strong. They'll say it's nothing, I'll get over it. So many times men are the ones that tend to present when the thing has so-called entered their body. And now when we look at the cases in Lagos, one thing about Lagos is that a lot of people test here. Many people are traveling now, they test in Lagos. About 87.6% of our cases are people that reside in Lagos, while we have 3.2 foreign addresses. Those are people that are coming in. And that's one thing we have been seeing commonly, is that many people that are coming in, their day 2 tests are frequently positive. And we do day 2 tests for fully vaccinated because it gives us an idea that it's likely that that person was already incubating it. A day 7 test, it may mean that, many people are coming for vacation. They may have acquired it locally. And then we have a significant proportion from Ogun State as well. A lot of that work in Lagos live in Ogun State. And then you find out that many of the activities at this end of year, big activities are happening in Ogun State. So we also work together with Ogun State. We have meetings together and we track our infections. And because our labs test out too, for example, I saw a cluster of cases that came from a particular event that happened. So immediately we had to call the state epidemiologist of Ogun and say, our labs have tested in this place and they have plenty cases so that they can respond as well. So it's just to let us know that Lagos tests nearby states and also people that are traveling out. And usually when we discover positive cases of people traveling out, usually they ask them to postpone their travel essentially by 7 days. Although we know some people will test again and keep testing till they are negative, but that is the recommendation. Next slide, ma. Now, this is one slide I want us to look at. If we look at the distribution of cases by LGA, you can see that Etiosa has the largest number of cases. In fact, since this fourth wave has really started, Etiosa has about 80 to 90% of the cases that we are seeing. And they are followed by Ikeja, Koshofe, Surulere, and Alimosho. So where Etiosa is having 400, 500 cases a day, might have 80 cases in Ikeja, and then the other big LGAs. Meanwhile, we have less amounts in smaller LGAs. However, we realize too that in the rural areas, there may not be much testing, and that is why Lagos State is trying its best to make sure that people can access public testing. So Badagry is priority, Ekpe is priority, Bejuleki is priority, so that we make sure that testing is going on at those places. And I want to mention here that if people are symptomatic or they have been exposed to a confirmed case, they are allowed to go for free testing at any Lagos State public testing facility. It is free. I am not expected to pay. We have in each of the 20 LGAs. I know that some work better than others, but they will find a way to make sure you are tested. And if the push comes to shove, you can always come and test at the mainland hospital where we have the Lagos State Biobank. Next slide, ma. Sorry, I'm aware that we're going to more, so please, I will try to be very fast. Next slide, ma. So this is the age distribution. So you can see most are in the productive age group, but I want us to realize that you can see the pediatric age, it is coming up. So right now, when we did an analysis, we found out that now we are having up to 6% in this fourth wave of children, being positive for COVID. And it's important to note because many times children may not have symptoms, but they are still able to spread. I noticed that many schools closed abruptly. They didn't even have their end of year festivities and all that because a lot of children started having symptoms. In fact, when we did contact tracing today, a lot of people were calling. We found out they are children and we needed to talk to the parents. I know they'll say, it's only the child that is positive, but they were surprised and all that. And I had to explain that many times children may get it in school. And we want to emphasize the importance that please, if we discover cases, please report to the OEQA so that we can take appropriate measures. Even though schools have closed now, it's still good for them to say, if we discover a case, we had a case, parents should take note. In case any child develops symptoms, sometimes a child may not have more than a headache, a persisting headache, they've treated for malaria, and it turns out to be COVID. And it's good to know. Like, let me give you my own personal experience. My nephew turned out positive. They closed his school. At the end of the day, every single member of his household is positive, honestly. And his own, they do city value. His city value is the highest. So we're thinking, he's likely, to be the index case in his household. And he's just 5. But every other person in the house, came down with COVID, but thank God they're all well. So we should be aware that children can have infections and yet have silent infections, but they may still infect those around them. Next slide, ma. So this is just, I just want to show us the epidemiological picture. So it just adds weight to everything we have been saying today. So this is the slide showing the distribution of our cases by what kind of testing they did. And you can see we have passengers of interest who are called POI or inbound passengers. Then we have outbound passengers. We have local or routine testing. That's people that are testing but living within Lagos for any reason, and then unknown. So what I just wanted to point out is that amongst our positive cases, only about 30% are local. Another 30% are people that want to travel, while almost 30% are people that are coming in to the country. So it's good that we are aware of that. And I say so that when people come into the country, please let us encourage them to take that day 2 testing seriously before, they start going to greet people, engaging in festivities. I'm sure everybody has a family member that has come home for December. So please, let's encourage them, to do the right thing. I will stop on this slide. There's no need to go to the others. And the parting note I want to give is that please, let's get vaccinated. I think it's helping us, it's reducing time spent in the hospital. It's helping to reduce hospitalization. Like I said, we might still get COVID even though we're vaccinated, but for many people, they recover quicker. So please, let's encourage people to get vaccinated. Let's encourage our teachers in schools to get vaccinated. And I wanted to point out, for those that are coming into the country, Lagos State is taking it very seriously. I'm sure you know people that have been calling because they are getting summons to court. If they miss their day 2 tests, let them know. They are going to get summons to appear at the mobile court, and people are paying. Lagos State is taking it very seriously because you know we're the epicenter. Most people that will come into the country will come into Lagos. Lagos has a greater population. You know, Lagos is a country. That's what I'll just say. So please, I just want to end on this note that please, COVID is still a problem. I know that, you know, we think, this COVID again, it's still a problem. There's still people in hospital, but let us play our part. Let's get vaccinated. Let's encourage our children that what they learn in school, they should also do at home. Let's remind our parents that safety at home is safety in school. It's not the other way around. So the priority still falls with the parents to make sure that children learn and do the right thing. And then the school adds to this. So I'll just stop on this note because I know that today is Friday and I know many of us are going for Juma. So thank you very much. Over to you, moderator. Thank you for the opportunity, ma'am.
Oh, thank you so much, Dr. Adebayo, for that insightful analysis that you've given us, and I'm sure that our participants are following with all the charts that you've just shown us. If there are any questions, please just let us know right now that the experts are here to take all our questions. Please, we'll give about a minute or two for question and answer before we round up. Okay, so somebody wants to know the meaning of POI.
All right, ma'am. POI means passengers of interest. So it applies to any passenger coming from outside the country into Nigeria that may be suspected to have a disease of interest. So it's not only for COVID. So right now, if you're coming from any country, you're an inbound passenger, you're a passenger of interest. But like the definition changes. At the beginning, it was people from specific countries. For example, if there's an Ebola outbreak in a particular country, they will declare them POIs if people are coming from that country into Nigeria. So it just means passengers, international passengers of interest. Thank you very much, ma'am.
Okay, thank you. And I hope that participants have gotten the meaning of POI. I think we've come to the end of this session. Any final words, Dr. Bisola, Dr. Balogun, any final words?
I just want to thank you for the opportunity. And please, I just want to emphasize the importance that schools play. Many times, I think for our third wave, many of our cases started in schools. So please, it's really important. And like I said, we need to emphasize to parents as well the importance of keeping these rules, these protocols also at home and encouraging our children, you know, to do the right thing. And please, like Dr. Finney said before, once you have a case, please report. OEQA, the disease surveillance and notification officer or the medical officer of health of the local government, we all work together and we will be there. Even this term, we've done a lot of schools and you have support. Many schools are not even aware. We even get to arrange free testing in the schools. So please, there are opportunities that abound, and it's good for us to all work together, you know, for the success of Lagos State. And another key thing, we always tell people we're not in a hurry to shut schools. We don't want to disrupt the system. There is a process. So please do not panic and just shut down your school. No, there is a process. Inform OEQA. Usually they tell us, inform us as well. And there's a process to go about it. So I think I'll just stop on that note. Thank you very much, ma'am.
Okay, thank you so much. On behalf of the Director General Office of Education Quality Assurance in person of Mrs. Abiola Seriki Ayeni, also on behalf of Dr. Finney, the SSA to the Governor on Health, all our facilitators, would like to thank all the participants here present. We're about 62 now. I think we got to about 90 something people online. So thank you so much for joining this workshop, or we like call it a mini training. Please do know that we have an incident report form on our OAQA website on www.oaqalagos.com. So if you have any case, you can definitely report on that tool. It's there. And then the guideline can also be downloaded for free on oaqalagos.com. And on that note, I'm going to say a beautiful afternoon to everybody online. Do have a lovely weekend. Bye-bye.
Bye-bye,
Merry Christmas to everybody.
Thank you for having me. Bye.
Thank you.
Bye.